Hello and a very warm welcome to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing really good. Today we all are here at this Insta Live, and here we are going to discuss about a very important topic which is related to our skin, and that is acne. Yes, today we are going to talk about acne management. So we all are here to discuss about acne management, and as you will definitely agree with me that acne is something which keeps us all bothering. So it is just not related with our skin. Definitely, it's about the appearance, but deep down, it do affect our confidence level as well. And many times people go into depression just because they have this chronic skin condition known as acne. So today we will try to understand everything about acne, how to prevent acne, how to take care of acne, how to manage acne, what to do, what not to do. And for that today we are going to be joined by Dr. Vrutika Shah, a renowned skin expert from Mumbai, venereology and leprology. She earned her MBBS degree from Lokmanya Tilak Municipal Medical College in Mumbai, followed by a MD in dermatology, venereology, and leprology from Government Medical College, Nagpur, and a DND in the same specialty from the Directorate of National Board. Dr. Shah has garnered extensive clinical expertise also. She has been working with leading hospitals, including Sage GSMC and Kemp Hospital in Mumbai, and also GMC and various other hospitals of Nagpur. Her expertise span a range of procedures such as vitiligo surgery, acne scar treatment, etc., etc. Dr. Shah has also made notable contributions to the field through presentations and awards at various conferences and have been recognized with accolades such as the Dr. R. Ganpati Award for her e-poster on leprosy. So today we are going to be joined by Dr. Vrutika Shah, a renowned skin expert from Mumbai, and with her we'll like to discuss about acne and acne management. Acne vulgaris is something most of us has gone through that phase of acne vulgaris in our teens or young adolescence age. And that's so bothersome. So it's important to be informed. It's also important to know what to do and what not to do. Because, many a times we fall for what our friends or relatives tell us to do. Then there are these OTC, over the counter topical applications. Then these days, we have so many influencers on various social media platforms, and not all of them are qualified dermatologists. So it's also important to understand that just by following them blindly, is it going to help or make the condition even more worse? So today we are here to talk about acne and acne management. A very, easy way to prevent acne, as all of us say, that it is to have a more healthier skin, have a good skin barrier. And for that, of course, we need to follow a good skincare regimen. But now the question is, what skincare routine can we follow? Because in the market, again, market is flooded with products. There are so many brands or cosmetics claiming to, make your skin more healthy. But then we should always choose or go for something, a routine which is more basic, simple, minimalistic. We can be more consistent with that and make our skin more healthy. So today we are here to discuss about acne management. And in case you have any queries, questions related to the acne management, please feel free to write to us in the comment section. And again, we would like to welcome you all to this very Insta Live, where we are going to be joined shortly by Dr. Vrutika Shah. So today we are going to talk about acne and how to prevent acne. Again, a very big obsession in our society is for these home remedies. Now, do these home remedies really work? Because, the easiest way for us is to run inside our kitchen and apply something on our skin, especially on our acne. Is it going to help? Is it going to serve the purpose, or is it going to just make the condition even more worse? So, as I also said in the beginning, it's more important to know what to do and not to do when we are talking about acne. And here we go. We have with us Dr. Vrutika Shah. A very warm welcome to you, Doctor.
Yeah, hello. Good afternoon, everyone.
Good afternoon, doctor. We all are here to discuss a very important topic, which is acne management. And acne is so common and such a chronic skin condition, doctor.
Yeah.
First of all, we'd like to understand what is acne or what, causes acne.
So basically, acne is a chronic condition of pilosebaceous unit. So it just doesn't happen over a small period of time. It happens over a long duration, and basically it affects the sebaceous glands which are present in our body.
Mhm.
These glands are mostly rich in our face near the T area, majorly on the chest and back. So acne can affect all these areas.
Okay, right. And doctor, many times we see these small bumps, what as layman we call them whitehead, blackhead. Then gradually हमें दिखता है कि वो थोड़े और बड़े हो गए हैं, then pus उनमें आ जाता है, then many a times they are really big and painful. So are these the various grades of acne and what are the various types and grades of acne if you can just shed some more light over that?
Yeah, so as you rightly said, these blackheads and whiteheads, they are called as microcomedones. So they are the first grade of acne. So usually while in teenage, we commonly face with this condition. If they are not treated, they turn into stage 2, where we can see small red bumps. If they are not treated, then again they goes in grade 3 and grade 4. So in grade 3, majorly we see pustules, pus-filled lesions are there, and in grade 4 we see big nodular lesions. They are very big and painful.
Right.
So if we don't treat the acne at time, these nodular lesions eventually lead to scarring, and the scarring then is very permanent and is very difficult to treat.
Right. And as you said in the beginning, that, it's a gradual process. They'll first, appear in very small size. Gradually, they'll increase in size. So it's always a good idea to go and consult a qualified dermat as soon as you spot these acne on your skin. Don't wait for them to grow because, as doctor had just said, they can lead, the bigger acne can lead bigger marks and scars. And treating acne is one thing, but treating those marks and scars becomes the more, it looks like the bigger challenge. So, doctor, because it is important to take care of our skin also and make it more, healthier or making a good skin barrier. Skincare routine that we can follow, a very minimalistic, which we all can go for, adopt, and be more consistent with it.
So basically with skincare, I would advise first we should start with a good sunscreen which suits the acne prone skin. It can be a gel based and commonly it should be a broad spectrum and it should be non-comedogenic. So with these parameters on the sunscreen and minimally SPF 30, this much is present, you are okay to go ahead with the sunscreen. And a very lightweight moisturizer because already in acne there is excessive of sebum production. So already the skin is very oily. So if
Hmm.
we use a heavy moisturizer, it will clog the pores more and it will lead to more acne. So very light moisturizer, and we can start with the night topical retinol gel or a cream which will take care of the grade 1 and grade 2 stage of acne. If the acne becomes more severe, then we would like to add on some oral medicines so that the scarring doesn't set in and the acne gets clear faster.
Fair enough. But, as we are so obsessed with home remedies or over-the-counter medication or topical applications, and market is flooded with such products. Now, we go and land up in front of a doctor really late, and I'm sure you also get patients who have done a lot of experiment on their skin, on their acne before coming to you. Now,
Yes.
my question to you is, doctor, as you said, it's important to go and consult a qualified dermat as soon as you spot these, acne or small bumps, etc. What happens if a person goes for these home remedies and, applying, natural thing is one thing, but then applying toothpaste, garlic, lemon juice on the acne, then going for over-the-counter medications? Do they really help or they make the condition even more bad or worse?
They eventually make the skin worse because there can be contact dermatitis with all these conditions. They can eventually lead to skin burn. and then eventually lead to pigmentation. So I would like my audience to tell them avoid all these home remedies. Even with
Mhm.
OTC products, many a times the chemist prescribe topical steroids for acne, which are not good for your skin at all. Initially, you might feel that they are reducing the acne, but over the time, the skin becomes thin, atrophied, and it eventually damages your upper layer of skin. So, I would again request my audience that whenever, if you feel, consult your dermatologist as soon as possible, but avoid all these home care remedies, over the counter products from the medical.
Okay, so home remedies, over-the-counter topical applications, these are a big no-no. Please go and consult a doctor as soon as you see these acne on your face.
Yeah.
Now, during teenage, when a person attains puberty, we all know that a lot of hormonal changes takes place, and that's when we get our first acne. But again, it becomes so chronic, and many times their parents will feel that it is a natural thing to happen. Then why to go and consult a doctor? Because eventually the acne will subside, it will go away. Then why it's important, even during teenage, when we know it's a natural process, to go and consult a doctor? Is it because of the scarring that it leaves?
Yeah, definitely. It's because of the scarring and the pigmentation marks. We should consult the dermatologist as soon as possible because initially people were not aware about this. And if you see, they the old people, they now all have acne scar marks. Whoever used to have acne in childhood, but as soon as you treat acne in puberty, there are very less chances of getting scars and pigmentation. So we can say you will get a very confident skin, so you can step out of your home. Initially, the
Right.
awareness was not that much, but now as soon as the awareness is increasing, it's better to
Hmm.
consult a dermatologist as soon as possible.
Right. And as we were discussing before that, treating acne is one thing, but treating the post-acne marks or scars, it looks like the bigger challenge. It is very
Correct.
difficult. And it looks like that scars and marks are forever, ever and ever. So in case you don't want these marks or scars, please go to the doctor as soon as possible. So that will help you not have those post-acne inflammatory marks or scars. Now,
Correct.
doctor, many times, especially people who have a very oily skin or who have acne-prone skin, they feel that it's because of the excessive oil that acne is forming. Of course, that's the reason, but then they keep on washing their face in again and again. They feel that, if they'll keep their face oil-free, by cleaning their face with a cleanser, it will help in reducing the sebum formation, and also it will help them having a dirt-free, dust-free face. Thus, they'll have a clear acne-free skin. Is it true or is it a myth?
See, usually washing your face 2 to 3 times a day is recommended. Excessive washing can damage your skin barrier and it can lead to excessive of dryness, and to treat that dryness also becomes difficult, and so that's why 2 to 3 times per day is sufficient, and you can use a normal salicylic acid, tea tree oil based cleansers, face wash that are sufficient.
Hmm. Okay. So cleansing your face 2 to 3 times is more than sufficient. Now,
Sufficient,
doctor,
yeah.
with moisturizer, as you said, it's important to moisturize your skin. Even if you have oily skin, the most important part is to choose the right kind of moisturizer. You said, it should be light, it should be something which does not clog your pores, etc. Now, many times, especially people who have a oily skin, they avoid the whole moisturization part just because they feel that, they are already producing so much of sebum. That's why it is important to apply a moisturizer. So, how would you like to address that?
So basically, the acne damages our skin barrier. So it is important to moisturize to maintain that barrier. If the barrier is not maintained, then there are more chances of getting acne elsewhere on your face, and eventually, then it will lead to more acne formation. So even a very light based moisturizer should be used so that
Hmm.
the barrier is maintained and you can continue with your another active treatment regimen, because once you start using the retinol gels, eventually the skin leads to dryness, the barrier is disturbed. So that's why using a moisturizer becomes more essential.
Right. Just to make a good, healthy barrier, skin barrier, you need a moisturizer on a regular routine basis, and choose your moisturizer correctly. In case of doubt, please go and consult your doctor, consult your dermat for helping you choosing the right kind of moisturizer. The same goes with sunscreens, doctor, because in our society, the saddest part is that still 70% people are not using sunscreen on a regular basis. We feel that only we need sunscreen only when we are going out or stepping out under the sun. So those who are working from home, those who are working from offices which is completely closed, no ray of sun, etc., they feel that they don't need a sunscreen on a regular basis. So a, is it equally important for those who are working from their house or offices, etc., to apply sunscreen, uh, even if they have acne prone skin?
Yeah, using sunscreen is more important because all these lights inside the office also, the visible light which we get from laptop, screen time, mobile devices and all these lights also hamper the skin. And if we don't use the sunscreen, there are more chances of increasing the post-acne pigmentation and post-acne spots. So to avoid that pigmentation and spots, it becomes more essential using a sunscreen on daily basis, even if you're indoors, even if you're in the office, even if you're work from home. Still, it's very essential.
And what to look for when we are going out to buy a sunscreen, because there are so many informations on the box containing the tube or the sunscreen. So what are the basics, especially if you have a oily or acne prone skin?
So usually gel-based, aqua gel-based sunscreens are good enough option for your oily acne-prone skin. They should be broad spectrum. They should be minimally SPF 30. SPF 50 also works good if there is a lot of sun exposure. And they should be basically, most important, non-comedogenic. So that again you don't get acne if the sunscreen is comedogenic. If your moisturizer is comedogenic, there are more chances of getting acne in future. So this is the basic thing. It should be mentioned, labeled on the sunscreen.
Right. Now, doctor, when a patient comes to you with acne, are there any tests that you normally recommend for the proper diagnosis, or just by clinical investigation, taking history, you're sure that this is the reason probably, and then you set your line of treatment?
So usually acne is a clinical diagnosis. Very rarely tests are required. And I would like to enlighten, basically if you're getting acne on forehead more, so that
Hmm.
indicates that you have a oily scalp, you have dandruff problem. So usually you should treat dandruff and oily scalp along with the acne. If you are acne more in the jawline area, usually in females, so that indicates a hormonal imbalance. So in that scenario, we prescribe additional tests for hormonal imbalance to rule out if any. Because if we don't treat the hormonal imbalance, the acne is going to recur again and again in spite of treating it's the acne. So treating the hormonal imbalance also becomes a necessity. So that time we advise blood test. And if at all we want to start any medicines, then we advise blood test, oral medications. Otherwise, in general, for basic acne, it's a clinical diagnosis, and with topical management, no routine blood tests are required.
Okay. And what are the various treatment options, doctor?
So if there is grade 1, grade 2 acne, we start with sunscreens, moisturizers, topical retinols, azelaic acid, benzoyl peroxide gels, topical antibiotic gels with combination with retinols. But if it's a grade 3, grade 4 acne, we start with oral antibiotics, oral isotretinoin, oral hormonal medications if we suspect hormonal acne. And most importantly, along with this treatment, counseling the patient is very important. Because if we don't counsel the patient properly, they see acne is a gradual problem. So obviously within 1 month of treatment, you're not going to be acne free. So that counseling becomes very important. The patient should use the gels properly over the time, and they should follow proper lifestyle. I would like to add some light to the diet part also.
Sure.
So basically in diet, you should include more of plenty of oral fluids, more of water intake. You should be well hydrated, at least 2.5 to 3 liters of water daily. Avoid oily, deep fried food items, avoid junk, avoid fermented foods, pav, bread, maida. Dairy products also, once daily is fine. Excessive dairy products should be avoided. Minimally 1 cup of milk, 1 glass of buttermilk, thoda dahi, that much is fine. And you should include more of veggies, green leafy vegetables, salads, fruits more in your diet because they are rich in vitamins basically. So they are rich in antioxidants. So they also help naturally for your skin to glow. So even if in long time you maintain with your diet, then chances of getting acne again and again it reduces. And if you have hormonal acne, then you should be more focusing on your exercise part as well so that the hormones get balanced with normal exercises like 40-45 minutes of brisk walk, 15-20 minutes of cardio. That much is sufficient. Yoga, meditation. So that all is more important along with the treatment which the doctor prescribes.
Right. So treatment plus lifestyle modification, a good lifestyle really goes a long way in maintaining good skin health and preventing acne. And now talking about, as I said, preventing acne. We always say prevention is better than cure. Any way we can prevent having these acne, doctor?
Prevent if you're using a proper skincare routine, then that is the most important thing you can prevent your acne. Apart from that, girls these days are using more of makeup. So I would like to say you should keep washing frequently your makeup brushes, your sponge, so that with those makeup products also you don't keep getting acne. Should have a proper 7 to 8 hours of sleep. That is more important. And avoid stress maximum with yoga, meditation, exercise. That also helps you prevent acne and healthy lifestyle like diet, as I said.
Right. Many times it looks like vicious cycle,
Correct.
we get acne which makes us more stressed. Now that stress increase or exacerbate that acne, and it looks like a vicious cycle. But yeah, to break that cycle you need to go and consult a dermat at the first place. Second, follow and trust your doctor. That's really important. Doctor, I'm sure you will also agree with me. Many times what happens, for example, I am your patient and you have given me 2 months of medication. I'll start it with full flow, full energy. I'll go for it. And in 15 days, when I see that, okay, now my skin, texture is improving, my acne have subsided, I'll stop taking the medicines without informing the doctor because I'll feel that, okay, now I'm okay to go. But is it a good practice or we need to actually complete the medication?
Complete the medication is more important because acne is just not a exterior disorder. So all the
Hmm.
medications, all the course which we give is to completely eliminate the acne pathogens from your skin. So a proper completing the dose is more important rather than just if you feel 15 days means getting cleared, but that is not the scenario. If you complete the treatment, there are more chances that you won't get acne in future.
Okay, so completing the treatment is really important. So, A, please go and consult your dermat. B, follow the treatment. That's really important. Now, doctor, we would also like to talk about the treatment options we have for the post-acne inflammatory, mark or scars.
Yeah. So for post acne pigmentation, spots and scarring, there are a lot of treatment options available now. We start with basic same skincare routine, topical gels, and then we proceed to chemical peels. Various chemical peels are available now. Salicylic acid based, azelaic acid based, mandelic acid based, glycolic acid based. We can start with that. If patient has more of scarring rather than pigmentation, then we directly opt in for laser, microneedling with PRP. All these options they help to reduce the scarring to a great extent. And this is also 5-6 months treatment procedure. Obviously, within 1-2 sessions, you're not going to get your results. So, all in all, treating acne is since it's a chronic, gradual problem, I would say treating acne is also equally a gradual process. It's not like within 1 or 2 months you would be getting completely acne free, acne marks, acne scar free. It's a gradual process. So you have to show some patience and continue your treatment and trust your doctor. That is the most important thing.
Absolutely. And doctor, what about a good maintenance therapy?
So for maintenance, if you're completely acne free, you can continue with the topical retinol gel. It will in general help to keep your pores maintained. It will avoid with fine lines, wrinkles, and using sunscreen becomes more important while you are using topical retinol gel so that your barrier is maintained along with the moisturizer and you won't get any pigmentation, any scarring, any marks.
Fair enough. After talking about the weather right now, monsoon is going on. It's quite humid in most part of our country. And again, we get to see a lot of breakouts in this season. What is the reason and how to take care of it?
So most commonly reason becomes the humid climate which we are facing that
Mm-hmm.
blocks our sebaceous gland, the pores which I'm talking about, it clogs the pores and because of that there are high chances that we can get breakouts. So to avoid that, we should start using a good salicylic acid based face wash 2 to 3 times daily and we can continue or we can add on topical retinol gel if we are not using it so that we can prevent acne breakouts. And along with that, we can use a combination antibiotic with retinol based gel so that we don't get more acne, bigger acne.
Okay. Right. And doctor, you also mentioned before that taking care of your makeup products and your makeup applicators, brushes, etc., is equally important. Now, my question to you is: many times people who have acne ask that, can I do makeup? And what if it is a necessity for me? I mean, maybe it's my professional demand to do makeup. How to deal with it?
So you can use makeup, that is fine, no issue with that. You can use products which are suiting your skin. But under that makeup, I would suggest you use a good moisturizer, you use a good sunscreen, and keep makeup for the minimal time. You should not sleep with the makeup on. That increases more chances of acne. And as I said, you should wash your sponges, your brushes frequently so that they are not infected with the bacteria, or else there are more chances of getting acne. So with this basic, keep it for minimal time, and when washing the brushes, the chances of getting acne reduces.
Right. And always remember to remove your makeup properly, no matter how tired you are, how
Exactly.
late you are. Just make it a point to remove it properly. Now,
Yeah.
Dr. We are, continuously talking about acne and acne management. And many times people ask, even I'm getting few questions on how zinc impacts acne or helps in managing acne, importance of zinc.
So zinc is basically an immunomodulator. So it will help with modulating the immunity. It will help with the bacteria which are present during your acne grade 2, grade 3, grade 4 to help fight that bacteria. So you can add on zinc supplements. They are not a necessity, but it will help to some extent in
Hmm.
managing the acne.
Right. There's also a question about what kind of sunscreen to go for in case I have a oily skin.
So as I mentioned, it should be a aqua gel based. It should be a minimal SPF 30 plus, and it should be basically broad spectrum and non-comedogenic. So if these basic parameters are present on your sunscreen, you are good to go with it.
Fair enough. Doctor, it becomes so difficult to keep our fingers or our hands off our face, off our acne. And then there are people, who love squeezing out or popping their acne. They feel that this is the best way to get rid of it. What's your stand on it, and how to keep our hands or fingers away from our face?
Yeah, so that should be the last thing which you should do with your acne because it's called acne excori. So if you have that habit of picking your acne, it leads to more scarring, more pigmentation. So it's a complete big no. You should not pick your acne anytime at any point of the time, even if it's a grade 1 or grade 3, grade 4, however painful it is. Because treating that acne is easy, but treating the acne pigmentation, the acne marks, the acne scar becomes more difficult. So that is the last thing you should do with your acne.
Right. And Doctor, one more thing about acne and acne management is that, as you said, it's important to keep your hands off your face. It's important to not, squeeze your acne. But it's equally important to understand that acne is something which is a controllable situation. The only important part is to go and consult a qualified dermat. Now, when I say qualified dermat, I also means to refrain from going to any, parlor or any, because quackery is equally, rapidly increasing and people are falling for it. So how would you like to address that? Why it is so important to go and consult a qualified dermat rather than falling for anything else?
See, as I mentioned earlier, nowadays these parlor people, this quackery, they start prescribing directly steroid cream for treating acne, which is a big no, because these steroids, they eventually damage your skin, and it's a permanent damage. And actually, you can't do anything about it. Your skin becomes thin, atrophied. So, visiting a proper dermatologist becomes more important rather than going to parlor, saloon, and getting your acne treated with them. Because once the damage becomes permanent, then it becomes very much difficult to treat to repair the epidermal layer.
Right. So eventually they'll have to go and consult a dermat. So it's always a good idea to go to them at the first place.
First
Now,
place.
Doctor, before we wind up the whole session, any take-home message that you would like to share with our viewers?
So people always, my patients, they ask me what is the reason, common reason for acne. So I always tell them it's a multifactorial disease. So it's not like only a single thing which is leading to your acne. It, it's a group of, it's a multifactorial disease. So many factors, they lead to acne. So you should focus on your diet, exercise, lifestyle, your skincare routine. All this becomes a very important part for keeping your skin in a good, healthy skin. Your sleep
Right.
should be proper. You should be stress free. You should concentrate more on all these factors rather than just doing a proper skincare routine. If you want a healthy, acne free skin.
Absolutely. So a good skincare routine is there, but then you need to have a good lifestyle too. A healthy diet, a diet which comprises of more antioxidants, and what you need to avoid already have been discussed by our doctor. Thank you so very much, Dr. Vrutika Shah. It was wonderful talking to you. Thank you for this very informative session. Thank you so very much once again.
Thank you so much. Yeah, it was nice talking to the viewers. Thank you.
Thank you, Doctor. It was a pleasure having you. And viewers, thank you for your active participation in today's session. Stay happy, stay healthy, and take good care of yourself. Have a great day ahead. Goodbye.
Bye. Thank you.
Thank you, Doctor.